and the instruments needed for your crown and bridge setup. So we'll start by placing our PPE, our mask, our eyewear, and our gloves. My mask and my gloves are already on, so I'm going to go ahead and place my gloves. And let's start with the instruments needed for this lab. We will start with our moisture control devices, which is our HVE, saliva ejector, our air water syringe, 2x2 gauze, dry angles, and our cotton rolls. You will need your anesthetic setup, which is topical, and your cotton tip applicator, your crown and bridge burrs, high speed, your instruments, your cord, gingival retraction cord, your Hemident solution, your bond, dapping dish, your micro brush, your build-up material, your curing light, the trays for your preliminary and your final impression, crown and bridge scissors, heavy body material, and light body material. You will also need your Vita shade guide. So let's start by this going with the steps. A crown and or bridge will be indicated when over more than 30 to 40% of the tooth is needing a filling. The doctor will diagnose a crown, which is a complete covering that will completely cover the tooth to help for protection. So when the patient comes in, we will start with grabbing a preliminary impression. This can be done either after anesthesia or before anesthesia. I like to, if you do it one way, keep it that way all the time because it will help you remember and not to forget anything. So I preferably like to take mine after anesthesia just in case the patient does have a little bit of sensitivity. So I will start by connecting all of my pieces on. So I'm going to connect my HVE, my saliva ejector, my air water syringe. I'm going to set up my anesthetic syringe by starting with my topical, placing some topical on my cotton tip applicator. Then I'm going to set up my syringe. I have my needle, my anesthetic cartridge, my anesthetic syringe, and my needle protector. I'm going to go ahead and connect my high speed. Check my burrs, make sure I have all my diamond burrs that I need. Okay, so I will start with taking my preliminary impression. This is very important because without this you cannot make your temporary impression, your temporary crown at the end of the procedure. Okay, so once that is taken, you can set that to the side and the doctor can go ahead and administer his anesthetic. Once the patient is completely numb, then the doctor is ready to start to remove the decay. He will take his high speed, his crown and bridge burrs, and he will move the decay and begin to prep the tooth down for the crown prep. Once the tooth has been prepped down, we are ready to patch up any decay areas that were on the tooth. So we will use our composite material, just like if we were doing a composite. So we are going to start with our etch, our bond, and then we're going to place in the composite material to fill in any areas of decay that he removed out. Once the prep is nice and solid, then we can go ahead and take our Hemident. Okay, this helps control bleeding. We can pour just a little bit of it into our dapping dish. Take our gingival retraction cord. This is a 0. It comes in 00 all the way to a size 3, depending on the amount of gum tissue that we have to pull back from the margins. So I'm going to take a little piece of my gingival retraction cord and let it soak in my Hemident just for a few minutes. It doesn't need to soak long because this already comes with a blood controlling agent in it. So once my cord is ready in my Hemident, I will take my gingival cord packer and I'm going to take my cord and I'm going to wrap it all the way around the entire circumference of my prep. Okay, so The doctor has already prepped the tooth down, and I'm just going to gently take and roll the cord until it is completely tucked up underneath the gum. Okay. Next, I will take a cotton roll, have the patient bite down on it, okay, and that's going to allow that cord to expand that gingiva tissue out and help control some of the bleeding. In order to get a really, really nice final impression, we need the area free from a lot of bleeding. So while my patient is biting down on my retraction cord, we are going to go ahead and discuss some of our other instruments. I have my basic setup here, which is my mirror, explorer, my cotton forceps, my spoon excavator, again, just in case he needs to remove a small amount of decay from the tooth that he did not want to use the high speed for, my crown remover. So let's say the patient came in and they had an existing old crown on that now needs to be taken off. So the doctor can use this instrument to help remove that old crown. And then I have my cord packer, which you just saw because we packed the cord. And then I have my bite registration, my articulating paper and holder, which will be used to check the bite when we make our temporary crown. So our cord has sat long enough, the bleeding is nice and stopped. So now we are ready to start our final impression. The doctor can choose to leave the cord in while we're taking the impression, or he can take it out. That would be at his discretion. So now let's talk about our materials needed for that. So I have my heavy body, which would be the pink. And then I have my light body, which would be my orange. The assistant will load the triple tray, okay, with the heavy body material. You're going to load it from the back all the way to the front of the tray on both sides. While you're loading your tray, the doctor will take the light body and place it completely around the prep tooth. This will help to get the light body helps to flow down into that area that we expanded the gums so that the lab can see exactly how the doctor wants the crown to fit on the tooth. The doctor will place this in the patient's mouth. This is fast set, so it will take about 2 to 3 minutes for this to completely set up in the patient's mouth. Once it is done, the doctor will take it out. He will examine the impression to make sure there are no voids, no tears or rips. Once he approves it, then you will start to take the cord out if the doctor left it in, and then you will take your preliminary impression and start to make your temporary crown. Your final impression will go off to the lab with your lab slip and the shade that you retrieved earlier.